A Louisville doctor admits to drug and alcohol abuse, but he's still practicing medicine.
A WDRB investigation 4 months in the making. Valerie Chin details what the state of Kentucky found.
Documents show Louisville foot doctor Timothy Hanna admits to prescription drug and alcohol abuse and is still seeing patients. It's all legal and approved because of a new agreement by the Kentucky Board of Podiatry.
He performs surgeries every Friday. Sometimes it could be just 2, sometimes it could be 5 or 6 surgeries.
We started digging into this story 4 months ago. WDRB heard from patients and former employees like Ann, who didn't want to show her face. She was the office manager and certified podiatric medical assistant until she was fired, after Hanna accused her of falsifying hours worked, which she disputes.
He always had liquor all in his office. His trash cans were full of it.
Another former employee sent this to WDRB, saying she took this picture of empty mini Fireball bottles in Dr. Hanna's trash can. She claims she and others took out the office trash weekly, and this wasn't an isolated incident.
When did you start questioning whether he had an abuse problem?
The abuse problem probably came when we started getting, collectively, all the employees ranting emails that would start at about 6 p.m.
One patient even filed this complaint to the Board of Podiatry in September 2021, questioning why he told her another patient's private information and says he was shaking so badly he should not have been practicing podiatry with sharp instruments. Dr. Hanna blamed the shaking on not having eaten all morning. Another former employee who was also a patient and filed a complaint with the BOP tells WDRB, "I also noticed every time he had surgery he was very shaky and bouncing all over the place." And Ann says she witnessed it too.
When I began to work for him at his own practice, I could tell by the shaking, just a lot of impulsive behavior. It was pretty right off.
WDRB started asking the state about Dr. Hanna. Then on August 12th,
issue an emergency suspension pursuant to 2.
The BOP held a meeting addressing some of the complaints. The Board of Podiatry says it protects the public by administering and enforcing the statutes and regulations concerning the practice of podiatry. It's made up of 5 members, 4 podiatrists, and a consumer advocate.
What are your thoughts on him being suspended?
I definitely think that it's a good thing.
The board saying it received a complaint on May 25th that Dr. Hanna was practicing podiatry under the influence of prescription meds, including dates of October 2020, April 2021, and July through October 2021. The board says it received another complaint of Dr. Hanna practicing under the influence of alcohol and prescription meds and allegations of sexual harassment. And the complaints contain text messages, emails, and X-ray images. Former employees tell WDRB their boss, Dr. Hanna, also sent inappropriate text messages to female employees. This one around midnight in October 2021 says, "Tell me something sexy." Another text, "I like you so much, my wife hates it."
It wasn't just a matter of them thinking this is a disgruntled ex-employee. And yes, you know, his behavior as a boss and as a person was awfully appalling.
Ann says she filed the harassment complaints with the Kentucky Department of Labor. That department's Division of Wages and Hours confirms to WDRB it has an open investigation involving Dr. Hanna and can't release those records yet. The Board of Podiatry says Dr. Hanna admitted to drug and alcohol addiction and the complaints were adequately substantiated. This document says Dr. Hanna completed 90 days of rehab last March, but the board found, quote, "an emergency order is warranted due to insufficient proof of rehabilitation and due to the seriousness of the harms alleged and the complaints brought to the board." But just a week later, the board's discipline for Dr. Hanna went from suspension to probation, the board allowing Dr. Hanna to still practice podiatry under this deal.
Offer a 5-year suspension.
He has to pay 2 fines of $500 each and needs an evaluation from a psychologist. In this new agreed order, Dr. Hanna says he registered with the Kentucky Professionals Recovery Network for a 5-year monitoring period. He can see patients, with the board now dismissing the emergency suspension and complaints against him.
Unfortunately, due to never being held accountable, he has a false sense of grandeur as a surgeon. He really believes he can do no wrong.
Any Kentucky podiatrist getting disciplined is rare. Take a look. Dr. Hanna is now one of only 12 podiatrists disciplined by the board in decades. And there are 4 lawsuits filed against Dr. Hanna alleging negligence in providing medical care. In May, Dr. Hanna wrote this email to WDRB saying, "I honestly have nothing to hide, and this employee is going through some hard times, so I did not want to engage her further." He said he would be willing to cooperate with WDRB, but said, "I would highly advise against believing this person." Since then, Dr. Hanna has not returned our numerous calls and messages. But right before the story aired, he finally contacted WDRB, saying his attorney instructed him to not talk. And while Dr. Hanna is on probation in Kentucky, this record shows Dr. Hanna's license is still active in the Hoosier state with no restrictions. U of L Health, which owns Jewish Hospital, says Dr. Hanna's medical staff privileges were suspended on July 13th. Clark Memorial Hospital in Jeffersonville says Dr. Hanna resigned on May 4th, and Norton Healthcare says Dr. Hanna resigned his medical privileges in August 2020.
Because he does have people's lives in his hands, it's very important that he is regulated when he's performing surgeries.
We've asked the Board of Podiatry several questions about his decision, but the board is not commenting and hasn't released 71 pages related to the Dr. Hanna investigation to WDRB. Calls to Dr. Hanna's office show his office is still taking appointments. With photojournalist Stuart Hammer, Valerie Chin, WDRB News.
And if you have information about this story or any story you think our Investigates team should look into, just email us at investigate@wdrb.com or call 502-322-1297.